which is Redefining Patient-Centric Healthcare, for which I would like to call upon Dr. Malathi Arshanapalai. She is a Group Medical Service and Chief Quality Officer, Aster DM Healthcare, Dubai. Dr. Malathi is responsible for implementing quality protocols and standards across the DM healthcare vertical, such as hospitals, medical centers, and pharmacy, both India, UAE, Qatar, Bahrain, Manila, Oman. Oh my God. She has over 15 years of experience in teaching and research. She has served as head of clinical quality and compliance, responsible for implementing clinical protocols at Manipal Group of Hospitals. She has trained, supported, and audited NABH standards implementation at various hospitals across India. She has also played a key role in implementation of JCI standards at Fortis Group, Bangalore. She has conducted workshops on stress management, developed curriculum for fellowships for Manipal University, and coordinator for educational programs for DNB. Ma'am, it's a sheer pleasure. We are looking forward to hear you. Thank you.
Good morning, everybody. At the outset, a very big thank you to the organizers, in particular to the Sarvodaya Hospital, to my very good friend Bobby. It is indeed a proud privilege to be standing here in front of a very august gathering, dignitaries who are there, and it was such a pleasure to listen to all of them who have been my mentor, my colleagues, my advisors. And a very warm welcome to all of you that I can see there, youngsters, the budding nurses, and other professionals looking forward to bringing this very, very important, I would say, aspect of healthcare delivery. We all exist today, friends, is because there is someone writhing in pain in the beds of the hospital. If it were not for that one person, all of us would probably be jobless. Centric care. Having said this, patient-centric care, let me look at patient centricity and what it is all about, and why is it now being labeled and called redefining. So let me start by saying, people believe, many of them do think and talk a lot about the airline industry. We look at it and talk about the areas which are highlighted. We look at something very important into an aircraft and we say, is it technically viable? We also say, is it driven by competent people before I get into it? And I believe in it. And criteria for judging a particular airline, it is very personal, includes comfort, friendly service, on-time schedule, safety, and they keep asking you and reiterating, please give us a fair feedback. Even if you are a frequent flyer, we would like to tell you the safety rules. We know about this on the airline, and therefore, friends, patients judge us too. And that is by the standards that are being delivered, and very, very important today is a non-technical aspects. There is a focus by the patient on the soft skills of the healthcare provider. Communication has become the need of the hour. Let me start off by looking at a very, very important aspect, and that is, what was it at earlier times? We said that it was customer service focus. I call it as a past focus. We moved on, we progressed, and then there was this quality revolution, a movement which took by storm. And today, the present focus, the present is patient-centered care. And that means basically, we started off initially basic amenities, courteous behavior. People were happy with patient satisfaction survey. Even what they checked was, were they good, were they courteous, did the nurse take care of us? That was what was evaluated. it moved on. Quality came as a storm. And what did it bring about? It started on patient feedback on quality improvement. It went on to assess our processes, systems, and then NPS, the Net Promoter Score, became important. But did we stop with that? No. The present is patient experience. The theme for today. We moved on to say, what does the patient say to you? And the evolution of what you call as the patient reporting experience measures, patient reporting outcome measures, the PROM, and patient journey. My talk is going to revolve around this patient, patient, and patient. And he decides how good we are. What is this patient-centered care and what was the emergence? I don't know how many of you know Michael Ballant, a physician, and his wife Edith Ballant started off by coining this word, and they called it as patient-centered care. It simply means look at holistically. Do not look at the person as an element of only healthcare. Look at it from the point of view of his own mental well-being, emotional well-being, and look at him as a complete entity. So friends, let's start redefining patient-centric care. The focus basically is on these 5 very important elements. What are their elements? The core focus is the relationship between the provider and the patient. The provider and the receiver, the patient. Decision making. It was shared decision between the patient and the provider. Very important, the services. The services got adapted to accommodate the patient's needs. Moved on to technology, support tool was being used. Finally, data. The provider manages the data while promoting patient access. So these are the 5 core activities of patient care delivery. Now look at what has happened. The relationship which is between the provider and the patient became individualized, and that is patients slowly got empowered. They came into focus now. What happened with the decision making? Now patient drives the decision with the provider's guidance. That's why it became shared decision making. What happened to the service design? The service design built around the patient's need, input from the patient, patient's experience. Hospitals started developing, designing every part of the hospital as what the patient wants. Technology, now it became emphasis. Patients have become tech savvy. They are able to take their own appointments. You have various apps which are available, gets his lab reports straight from the portals. And then data, they have started control on the data. They have access. Patient's right to have the patient information is the need of the hour, and the patient is able to therefore demand and ask. At the same time, important is patient privacy. This became the patient redefined centric care. Therefore, in a nutshell, friends, the entire patient-centric care can be summarized into patient's cultural traditions, the personal attributes, family came in the picture, and their lifestyle. And the entire thing can be culminated in patient is now empowered. That is the crux of what we are calling today patient experience. The patient now knows and says, this is what I want to experience when I come into your hospital. If I were to put it around the patient in the center, what would this basically mean? The components of it, as you can see, have become slightly different. The family has come in the picture. The support and integration, the bystanders play a very, very key role. A second important aspect, it is all multidisciplinary. It is integrated care. It's not a single primary doctor taking care of the patient, and it moves seamlessly from one into the other. Third, digital component has become a very important aspect of healthcare delivery. Those hospitals which do not become tech savvy now may be left behind. So bringing technology has become, along with AI, the need of the hour. As I already mentioned, the patient needs emotional support during the care journey. Therefore, taking care of mental health is a part of the patient experience. Accessibility is very important to the patient care, and when he leaves the hospital, patient needs education. He needs to do what he has to follow up care continuum is the redefined model, and each one of these is now done accordingly. To give an example, family support for a pain management, very, very important. Continuity of care, they are given follow-up calls constantly. Digital health, he gets to know and gets his reports. Involvement at every point of time, empathy, mental support, psychological support, and very, very important, he wants his timing to be scheduled. He prefers to come on time. He expects that he is taken care on time. And finally, not last but the least, as a patient, I want to be listened. I want to know what is wrong with me, and therefore active listening becomes also an important core principle. And therefore, friends, we now move on. We all agree, needless to say, from the morning we have been talking about patient care delivery, but very important, if you saw the theme, it talked about mechanism. You've allocated the stores, you are ready to go. On the other hand, you scored very well, over 15 in operational excellence, which means get ready to go. Process mapping, you have started, you have excellent metrics, you have improved methodology, you have your teams. Start off on this. And finally, very important, you are ready to go for culture, and these are the elements that you have. So friends, that's the tool that you use, and you find that you have two of them quite well defined. Put them together, your hybrid model is ready, and you embark on your total. And there is a matrix which is easily available. I won't go into the details, but it clearly tells you what is your implementation time for each one of them. It tells you what is your cost, what is your efficiency, but look at the patient impact score. Depending on whichever you implement, you will get accordingly whether it is medium to high, whether you're going to get the best results or not. Your matrix is available. Whichever system you want to take in, put it into the matrix, and you know immediately if your patient satisfaction score is 15 to 20%, it will rise with technology. 20 to 25 if it is culture, 10 to 15 if it is operational, 18 to 22%. These have been worked out in various institutions, which I will show you very shortly. But remember, there will be obstacles in any change. Therefore, get prepared. Start with small programs. Baby steps, whichever you start, whether it is technology, operational, culture, engagement, it does not matter. But remember, be flexible and move on. Involve the patients in the designing. There will be resistance to change. Friends, all of us know, anything you want to begin, there will be a resistance. Be prepared. Whichever process you want to change, there has to be a team which works on only transformational change, tells you we are going into this. Staff involvement becomes the crux. Whether you choose technology, culture, operational, remember you will face this and go ahead with that. Remember, very important, are you ready with your finances? Many of the projects stop because of budgetary constraints, and therefore look at it at the most important, finances. Finally, even this morning there was an element which was whatever you put into place, can you measure it? Because what you don't measure, you can't monitor, and what you can't monitor, you can never improve. So the crux is always tangible mechanism of measuring anything that you do. So any process you take, please measure. And there are enough and more data available on each one of the experience model and what has been the outcome of implementing that. And therefore, let me come so that all of us know this is not the first time. Patient experience model has already been implemented, and I will tell you about 3 very important models, and one of them has been done pure technology driven is by Stanford. They went in for it at a go, and the pros were great delivery, great data. Cons, highly tech savvy people were required, but they went for it because they had the staff to go through it. Mayo chose organizational change. They said we will put up a model which is organization. Extensive staff involvement was there, employee empowerment, but what was the cons of it? Slow. It took a lot of time for implementation, but they had scored and they decided they will be a little slow, resource intensive. They had the resource. Very important was leadership commitment, and they went in for this model and they became a success. But I'm always proud to talk about this model, our very own model, and that is Arvind Eye Hospital. Their model of patient experience is operational efficiency. A beautiful model, and I had the proud privilege of being there for some days to actually witness this because it is a case study around the world. They chose operational efficiency. And what did they do? Standardized protocols. Very, very important. Process became optimized. What was the cons of it? Too much of standardization. Staff could resist. Experience and inefficiency can set in. But they were very conscious. And I want to share with you what did they do. Simple. Operational efficiency of the patient experience model. First and foremost, implementation. They did accessibility became the crux. They said every person should be able to get eye care, even in the rural areas. So what did they do? They put up accessibility and assembly line efficiency. Patient, there is no question, no time wasted. And one by one, as the patient comes in, protocols, check the eye, move to the next, refraction, get it done, move into the OT, get it done, get it out you are. Within 1 hour, the patient gets the best treatment that you can get in. And what did they next do? Unique initiative, establish totally vision centers in all the rural areas. Pick up, access people, bring them, get them done. That was operational efficiency. Very important. What did they achieve? Look at the data. More than totally 4 lakh surgery. Patient satisfaction rate shot over 96%. Data, measurement, monitoring, improvement, and cost by surgery by 70%. And that was what made the success program of getting so many patients annually and 90% reduction in travel time. So friends, here is operational efficiency model, but requires a lot of processes to be put in place. And as we were talking in the morning, mental health is a beautiful example of efficiency hybrid model. What did this particular Mind Strong Health do? They brought two things together, and out of that, one entire approach was AI. They went in for smartphone predictive analysis, privacy concern, clinical validation. This became AI model with efficiency. So as I was mentioning to you, use your tool, find out what you're scoring more than 15, what you're scoring more than 12, bring them together, and that makes your entire model. This is the model we ventured in a small way at Aster. It was a hybrid model, and all I wanted to search was in the emergency department, bringing in operation and AI. And that made a great difference because we had huge footfalls into the emergency department, which is the image of the hospital. Instead of putting it up to the entire hospital, we said, let's try the program, patient experience model, emergency department. And all that was done was AI-powered triage system, point of care, every testing as much as possible, direct in the emergency, AI tools, everything is chatbot. It keeps initiating, though the decision maker is the clinician, but he gets a prompt for every type of symptom which comes in, and they are all developed internally. We did not have enough money to put it on to get apps from outside, but we developed with our IT team, and everything was integrated with the EMR. Patient flow, green OPD, anybody coming with minor symptoms, move on. But the OPD was in the emergency department. It was called fast track green OPD. So we start cluttering was removed, and finally arrival itself was a mobile check-in. So friends, that was a hybrid model. The same model, many of you might be aware, has come into home care services. This is patient experience, as you can say, throughout in a patient-centric, already available and going on in many places where home care is the crux of care delivery system. You don't have to speak as well. Thank you. So therefore, coming back to what we spoke in the morning, friends, it is not just patient looking at him, it is his journey. And therefore, every point becomes important. Unless you touch at every point, patient experience cannot be taken as a holistic approach. What does that basically mean? The patient approach even before he reaches the hospital. Your pre-employment, your education starts, and that is what we call it as the first step. Very, very important. He arrives. How do you take care at that point? Your second touch point starts from there. It could be your valet parking, it could be your lift services. It starts with the second touch point. Third, very, very important, expectation management. The real wait time, telling them you have to wait. This will happen, manages expectation. Priority lanes. The same what happens, your pharmacy. You could stand in a separate lane if you have only 2 medications, 10 medications, 15 medications. Do it what you have in your malls. It works wonders, even with patients. Very, very important. Pre-admission. Tell him what you want him to be prepared with. Before even he comes for surgery, he knows what is expected of him. Very, very important. Personalized care journey. Tablets. Give him, empower him. He will tell you, he will enter his own assessment, he will ask you the questions, what he wants to know. Care coordination, everything is seamless. Clinics are set up so that they move from one into the other. And finally, we have been talking about patient experience is empowerment of your patients. It might be good that my door-to-balloon time of my cardiology department would be probably within the time of 60 minutes. But if the patient says, I still have angina, I am unable to do my work that was expected earlier, I still have failed. But clinical outcomes, fantastic. Patient reported outcomes, I have scored a 0. So friends, the need of the hour is patient decides how you have fared. And that is why we say quality is as determined by the receiver and never the provider. So proms and prems have become the need of the hour. With this, I would like to end by saying, having talked about the experience models, the tools and implementation, the future direction is all about artificial intelligence. People are still the most important. But the person who is going to fail is the one who does not know how to use the clinical support systems. Very important, complying with regulations and evidence-based practices, chronic disease management is the crux now. Therefore, friends, I'd like to end by saying, please set your goals. As I said, the 4 themes are available. You want to be technology driven, you want to be operational driven, you want to be culture driven, you want to be organizational driven. It is all with you to decide. Decide single, hybrid model and be ready with a mathematical score. Put your power goals. All that is required is sustained commitment and continuous adaptation. What is important finally is transform your culture. Very important, bring your systemic change. And what do you get? I ended with a journey. So address the touch points, prioritize, and then you say, you get your patient loyalty. With this, let me end by saying a big thank you. But what is most important is we need to move towards a global future where patient-centric care is the norm and not the expectation. Thank you. Thank you very much.
Thank you so much, ma'am, and I'm sure all of you, including me, we are in a deep thought. Which model, what to adapt, whether the hybrid or a single model. I think it is going to be each to curate. We have to curate it as per our organization's need and which path do we choose. May I now request Dr. Uma Nambia ma'am to please come on stage and felicitate ma'am. Ma'am, please. Yeah. That was a really thought-provoking session, and we would like to thank Dr. Arshanapalai for that wonderful session.